Today, the Alzheimer's Association released the findings from its annual Alzheimer's disease report. We're learning more about how dementia is affecting people with a diagnosis and those who care for them. Here with me today is Dr. Sam Fazio from the Alzheimer's Association. Thank you so much for being here.
Well, thank you for having me.
So there's a lot of data and information in this new report. What's the biggest takeaway for you?
The Alzheimer's Association Facts and Figures report really shows us that Alzheimer's disease continues to have a significant impact on individuals, families, and our nation as a whole. So currently, it shows us that 6.9 million Americans currently have the disease, and it is estimated that it's costing our nation $360 billion. To put that into perspective, that's $15 billion more than just a year ago. So you see how this continues to be an increasing public health crisis.
Yeah, you just mentioned some of those national numbers, but this report also delves into how this is affecting individual states. What trends are we seeing in Wisconsin?
Yeah, in Wisconsin, we see the numbers significantly growing too. There are more than 110,000 individuals age 65 or older living with Alzheimer's dementia, and there are more than 200,000 family and friends who serve as their caregivers.
You just started to talk about the care. People with Alzheimer's or dementia do require quite a bit of care. How much time are those caregivers putting in, and what do we know about who those caregivers are?
Well, our caregivers are everyone, right? So everyone could be a caregiver. We see that the majority of folks are women. Caregivers, like you mentioned, do spend a lot of time, and as the disease progresses, that caregiving gets more and more intense. So our report showed us that caregivers really want and need help to navigate this disease. And they told us some things like, coordinating doctor's visits or finding respite or simply just having somebody available to answer their questions about what to do next after they get the diagnosis.
What can we do to improve dementia care and support the people living with the diagnosis and their caregivers throughout that whole process?
Well, we hope that this special report really serves as a catalyst for change with healthcare systems. So, care navigation can really help people find their way through these complex systems, and with a disease that's so complicated as Alzheimer's dementia. So, health systems can take a very simple step of just having somebody available to answer questions when people get diagnosed so that they could know what to do next and ask any questions about the disease and really help them find their way.
Dr. Fazio, this is a really important topic. I know it touches so many people and families. Thank you so much for joining us today.
Oh, thank you so much for having me.